day ago, I had spinal stenosis done, where my vertebrae, also in three discs, were actually cut. Some of the bone was cut off and some of the fat was taken out as well. And they went 6 inches up and 3 inches down into stenosis, almost like rotor-rootering is what he called it. And I've been in pain severely, okay? So I came here and I saw this incredible, I can't remember the name of it now.
QRS.
Yeah.
QRS.
And so I lied down for, I think it was 45 minutes, and I got off and I'm doing this, and that's the surgery.
Wow.
And normally I'm taking one of these little guys every 2 hours because of the pain, and I haven't had one for an hour before I got on this. I don't really have any pain back here. I mean, look at this. This is nuts. I'm doing salsa. I'm doing salsa here. I shouldn't overdo it. I know it, but you know the pain is actually, I would say, more than 70% gone right now. Wow, it's absolutely amazing. Absolutely amazing. You guys are the real deal. So that's phenomenal.
Yes, I'm Dr. Michael Freud from Comprehensive Care in Northwest Indiana. I'm an osteopathic practitioner who does nothing but injury care. We take care of workman's injury, private injury, take care of municipalities and state agencies and federal agencies and all kinds of nice folks who come to us with issue. I had one of the company owners who owned a large construction company asked me to see his mother, who had tripped in her own home and had taken a fall, and she had just been placed into a rehabilitative institute locally. And she had gone through a number of physicians, inclusive of orthopods, neurologists, rehab physicians. She was left with inability to stand and weight bear, especially right side, and had pain into the buttocks region and into her pelvis. So I gave her a QRS system that I had been provided with, and I had her sit on the intensified pad on a daily basis, and she told me that she sat on it throughout the day. She had her only pain relief while sitting on the QRS system. Within less than a month's time, 2 to 3 weeks maybe, she was up and around walking, and she didn't want to give me back the system. She appreciated it so much that she asked me if she could keep it even beyond her ability to stand because she still had a little bit of an ache. She kept it. She brought in a lovely gift for me when she returned it, and she said, I don't know what it does, but it helped diminish the pain, where she now was able to get into her own little pool that her son had provided her with, that she was using on a daily basis before her trip and fall, and she never thought that she'd be able to climb in and out of it again under her own strength. I can't tell you, I can't be more thrilled with the outcome. I just can't wait for somebody to maybe give these things a stamp of approval so that we'll have a further ability to use them for our patient care. That was my 83-year-old, but I continue to have the cases that give us our greatest challenge. I continue to try to use the device on them. And she ended up having this individual side knee replacement surgery and had a foot drop following a little bit of a traumatizing of the nerve, and they had her on all your gabapentins, they had her in therapy. She even tried acupuncture to no success, and she wasn't able to drive. She had very limited ability to walk. She was already wearing a assisted device for her foot, and I asked her to give the QRS system a try, and she religiously used it every day and returned it to us after about 6 weeks of use. And she drove here without her husband's help, and she walked in without gait imbalance, and she had no further foot drop, and it was the only device that significantly changed her outcome. And because of it, it's one of the things I continue to believe in my cases that have these vague challenges that you don't have a direct way of isolating or improving the outcome. The system seems to do a fabulous job, and I'm going to continue to use it despite the fact that I can't bill for the damn thing. I'm going to give it to the patients that want to have the improvement and are willing to try it. I used it myself. I've used it on elderly. I've used it now on this young lady, and I'm going to continue to use it in every case I can. So I can't tell you enough. I endorse this system. I I always am a second-generation osteopathic physician, and we're always trying to find a better way to improve the outcome of our patients. I can't tell you enough thank you. Appreciate it very much.
Now, just to be clear, we are not talking about static magnets like the kind you stick on the fridge. This is pulsed electromagnetic fields. It's pulsing, moving energy, much more powerful than static magnets. So here's how it could work for your patients. All right, so this is really important. I want you to understand it well. Here's what researchers say magnetic fields are doing inside the body. Inside this mat, there are electrical coils. And when electricity passes through there, it creates a magnetic field that moves through the body. And it talks, it whispers. There's 75 trillion cells in your body. And it goes deep into your body, places where sports screens and heating pads could never reach. For example, down around the spine, where that red angry area is. Now, the magnetic field turns on, and when it does it, it activates these ions, these charged particles, and there are proteins in there, and there's signals in there, stirs these things up, and these charged particles bring in nutrients, but they also begin to influence things like blood supply. Now, when the blood vessels are going in here, the red blood cells are actually stacked. See, they're stacked like that. They're not supposed to be stacked. When they're irritated, that happens. So when you pass magnetic fields through there, that yellow line, it opens up the blood vessel, it breaks apart these red cells. They're not stacked like coins, so you can get deep healing, better oxygen supply, so the healing process takes place. You don't just feel better, you are better. That's an important advance for us, one that we haven't been really practicing until today, because today we're going to change the dealer. Some of the studies have been done with these whole body mats that I showed in that animation, and I've got one over here. Let's run over here, I'll show this to you. So these devices are pretty straightforward. There are many different ways you can get moving electromagnetic pulses.